Method number 3 is somewhat different in that it doesn't always or only rely on some of these ideas of holographic correspondences. And this is one that is really important in Dong's acupuncture that we really have to address, especially when we're looking at psycho-emotional conditions, because psycho-emotional conditions don't always say, oh, it's just my knee, right? Or it's just my head, right? We're looking at how do we do global organ regulation. So the name of this is selection of points by affected channel, but what it really means is we're choosing a group of points, and we'll define Daoma needling in just a second for those of you who are new. We're using a group of points that have global regulating functions on in particular, one of the 5 zang. And what these do is they do overall regulation of one of the 5 zang organs. And these points are located mostly on group 7 and 8. I mean, we have Daoma combinations that affect the organs obviously all over the body, but the main ones we're looking at are in zone 7 and 8. So first, let's discuss what is this thing called Daoma needling. Daoma needling is an essential strategy within Dong's acupuncture, where it's a combination of usually 3, sometimes we can do 2 needles, along a certain area of the body with the goal of getting a sort of a better therapeutic stimulus through one small segment of the body. The most common orientation is called the vertical 3 needles Daoma point combining method. To illustrate this point, we'll talk about TCM points. So let's say someone has nausea, right? This is the example we give all the time. What point treats nausea that every TCM practitioner will go to first? Points like pericardium 6 treat nausea, right? This is, every TCM practitioner think, oh, nausea, pericardium 6, excellent. But you know what else treats or chest pain, pericardium 6, excellent. You know what else treats nausea? Guess what? Pericardium 7, pericardium 6, pericardium 5, pericardium 4, they all treat nausea. Pericardium 4 and 5 also really good at treating chest pain. So who says we can't do as a strategy of needling pericardium 6, 5, 4, 3 needles in a row along the pericardium channel, right? Why not? That will give us a better potentially therapeutic effect on treating nausea, right? Interestingly, there is quite a I find fascinating link between the Ma Dan Yang heavenly star points and Daoma needling. That's a little teaser for those of you who were here yesterday. You're in the club now, you know the answer. But we talk about that during our Neijing and Nanjing lecture, the relationship between Ma Dan Yang heavenly star points and Daoma needling, because there's an interesting sort of strategic method that Ma Dan Yang gives us that may very well be an early precursor of Daoma needling concepts. Yeah. So in Dong's acupuncture, frequently we will use points distributed in a line along this sort of proximal distal line, right? That's what we call the vertical 3 needles Daoma needling. This is such an essential strategy in Dong's acupuncture that many points are just given one name. So for example, Donna gave you the preview of some of the Dong points on the eLotus website. There's this point called Fuka on the thumb, means gynecology, and it's just one name, but they're 2 needles, right? That's a Daoma combination. So sometimes it's so essential of an idea that sometimes we just give it one name, like it's one point, but it's actually 2 or 3 needles that we add, okay? That's the basic idea of Daoma needling. We have other configurations. One's called the horizontal 3 needles. This is points that go across channels. One is called a triangular 3 needles, which is 2 points on one channel and 1 nearby. An example of a horizontal Daoma needling combination would be, for example, let's say someone has headache and we needle liver 3, stomach 43, gallbladder 41. They cut across channels, but since all of them are on the foot, they all go to the head. Okay. A triangular Daoma group, for those of you who remember Dr. Tan, means 2 points on one channel, like Lingu and Dabai, with Zhongbai as a third. So the Daoma means inverted horse. The exact etymology of why they call it Dharma is a bigger topic, and it's an area of debate. We don't really know exactly. People will say they know, but there are different opinions. So Dharma means a horse turned upside down. So think about like the legs. You see the legs in the air right next to each other. Kind of, for horse lovers, an awful visual image, but if that helps you remember it. The important though is like what's the application of Dharma needling? Okay. Right, so this really sort of highlights the zone strategy. The other thing that allows us to do, as we'll see, is it allows us to course upper, middle, and lower jiao through one specific area of the body. And we'll see what that looks like rather shortly. Okay? That's Dharma needling. So this is really an important feature of Dong's acupuncture. So one of the features of Dong's acupuncture is that we can regulate the entire body through a small segment of the body. Okay? So for example, there are a set of points on, we don't necessarily use them. This one I've not used them as a Dharma group. There's a set of points on the forearm that relates to the heart, the liver, and the intestines. Notice it's upper jiao, middle jiao, lower jiao. Okay? So on the hand, we saw this. Let's go back to, it's too far back. I'm not going to go all the way back to the slide. You just have to remember back to the slide. Remember on the hand in the second metacarpal microsystem, this point here, the location of large intestine 3, Sanjian, relates to the head, the upper body. Hegu, large intestine 4, relates to the middle of the body. And this point all the way down here in Dong's acupuncture called Lingu relates to the lower part of the body. So here we have upper jiao, middle jiao, lower jiao. We have a point combination, Dharma point combination called the Zhang Sanjian, which means the metacarpal 3 needles. The word Zhang literally means palm, but it doesn't mean palm 3 needles. The word Zhang here in Chinese, for those of you who speak Chinese, is a shorthand for Jianggu, which means metacarpal bone, right? Palm bone is metacarpal bone. So we call this metacarpal 3 needles, where we basically needle, just use the TCM words so people can follow along. Large intestine 3, large intestine 4, and Lingu, 3 needles. That's a Dhamma combination. What happens when we needle large intestine 3, large intestine 4, and Lingu? What are we stimulating? Think about it for a second, relating to this slide. Upper jiao, middle jiao, lower jiao. So by needling these 3 points, right, we're stimulating qi and blood circulation in the entire body. So if you really want to use 4 gates to treat everything, right, then you needle. So the 4 gates are going to be 1, 2, 3 plus liver 3 on the foot, right? Everything. And yeah, this is where if you want to treat, for example, the spine, then you needle closer to the bone and more deeply, right? If we want to use it to treat the flesh, we can needle more into the fleshy part of the hand. But that's the idea of Dharma needling, is that it treats upper jiao, middle jiao, lower jiao, all basically at the same time. Okay? All right. Questions about anything up to there so far? We're all good? Let's take a look at some of the main Dharma groups now in Dong's acupuncture. Okay. So in zone, as I said here, so this treatment method uses less, it relies less on some of the basic imaging and channel associations, although it doesn't completely leave it, but it relies less on those ideas and more on what specific group of points is an overall regulator of a specific organ system. And we will see that Master Dong uses basically, with kidney gets 2. Kidney is so important, we get 2 Dharma groups. But we have a Dharma point combination in zone 7 or 8 that relates to each of the 5 viscera. So Master Dong's main diagnostic paradigm himself was diagnosis of the 5 viscera, the 5 Zhang organs. So let's do a quick review of the 5 main Dharma point groups, because this then will bring us into the realm of mental emotional treatment, right? And you'll see very clearly how this brings us into the realm. If we don't understand these points, we're going to have a hard time understanding the point protocols. So the first point group here, that's called the 祖司马, sometimes translated as the 4 horses. You can also translate this as a team of horses. The Chinese word 四 here does not actually, it's not 四 as the number 4. It means a group of horses, a team of horses. The name itself is actually a reference to a star constellation called the Tian Sima, the heavenly group of horses, or the heavenly team of horses, which is a group of 4 stars, which is sometimes why they call it the 4 horses, found in the modern or the Western constellation of Scorpio. And there's all sorts of interesting cultural associations that help us understand why that name means what it is. I have a footnote on the meaning of the name in the Practical Atlas. So this is on zone 8. We're looking at 88.17, 18, and 19. It's called upper Sima, middle Sima, and lower Sima. Okay. These points are located along basically the stomach channel. The easiest way to find these, and I think the most accurate way to find them, is on the lateral edge of the femur. So we're on the lateral edge of the bone. The middle point, so if I'll borrow a Dr. Tanism, since I liked Dr. Tan's teaching quite a bit, 88.17, the quick and dirty way of finding it, as Dr. Tan would have said, is we locate it roughly at the height of gallbladder 31. So you find gallbladder 31 on the patient and you go anterior until you get to the lateral edge of the bone. And that's where 88.17 is located. The upper Sima is 2 Tsun above that, along the same line of the bone. And the lower Sima is 2 Tsun distal to the middle Sima. Right? That's the 3 points together. So we're looking at Sima Shang, upper Sima, Sima Zhong, and then Sima Xia. 88, 17, 18, and 19. Notice here, even the numbering system doesn't go, right? Numbering system is middle, above it, and below it. So again, forget the numbering system, just learn the names. This is the main Daoma group for lungs, right? So the Sima, this is what you keep in your mind, Sima is lungs. Okay. And Master Dong, this is something that Master Dong did say out loud. He basically said, whenever we have a chronic problem, the first thing we need to do is choose the organ and then choose one of these Daoma groups. It's actually relatively straightforward. It's beautiful. There's beautiful simplicity in the system. So when we're dealing with lungs, we can even think of this as dealing with things like grief, as we'll see related to lungs. This is the set of points that we can start with, potentially, right? One of the options. We don't always have to treat the organ directly. So the middle Sima, right, Sima Zhong, which is 8817, is at the height of Fengshe. Okay, so the middle Sima is at the height of Windy City, gallbladder 31. Okay, so you can see it on the side diagram. 88.25, which is middle 9 miles, overlaps gallbladder 31. It's at that same height. Okay, everyone okay on that one so far? Let's go to the next Daoma group. We'll review some of these again in a little more detail later. This one is called the lower 3 emperors. Now, in English, you can call it the 3 emperors. The lower here is, honestly, it's unnecessary. You know, some students ask me, where are the upper 3 emperors? There are no upper 3 emperors. The reason we say it's the lower 3 emperors is because in Chinese, 3 emperors, San Huang, sounds exactly the same as 3 yellows, San Huang, same tone even, right? So if you simply say San Huang in Chinese without writing it out, it sounds exactly the same as 3 yellows and 3 emperors. So in Chinese, to differentiate, we say if it's upper, which then means it's the yellows, or lower, which means it's the emperors. If you say it in English, no one cares. In English, it's just the three emperors or the three yellows. You don't have to specify upper or lower. It's only really essential in Chinese. The three emperors, the Xia San Huang, are Tian Huang, Heaven Emperor, Di Huang, Earth Emperor, and Ren Huang, Human Emperor. So it's basically, and we'll look at these in a more detailed fashion a little later, so we don't have to go into too much detail right now. Suffice it to say that this is the kidney, right? So the three emperors is kidney, one of the kidney Dhamma groups. And we'll talk about the difference between the kidney Dhamma groups eventually. The next group is the penetrate the kidney 3 needles. This is the second kidney Dhamma group. So this one is also Shen Tong, which means penetrate or connect. Say connect kidney. Is also kidney, right? This is a group in zone 8. So the three emperors is in zone 7. This group is in zone 8. This is 88.09, 10, and 11, right? These are along the spleen channel. 8809 is the medial superior corner of the patella. 8810 is 2 above that. And these are also along the femur. So this one is basically 8810 is more or less Xue Hai, spleen 10, sea of blood. And then 88.11. And like I said, we'll come back and talk in more detail about these points